Our team works on the intersection of weather, climate, and human health. So we're very interested in the effect or the impact of potentially climate change, but also day-to-day weather on human health.
This is a relatively unique field within meteorology, and it'd be tough to call it just meteorology. It's a very interdisciplinary field. I think one of the aspects that attracts me to it is that there are so many questions that remain unanswered. So you really have a chance to make an impact, and I think that that's also one of the things that attracts me is the potential to be able to make a societal impact with your work.
So we often work on dengue fever, which is a mosquito-borne disease. And so when we go out into the field, we're really collecting data on the mosquitoes, but also on the humans they bite, as well as the different types of ecological settings in which we find both the humans and the mosquitoes. So we collect immature mosquitoes, which is no easy task, let me tell you, when you have a little pipette and you're going from container to container, whether it's a tire or a bucket, and you're trying to take out larvae and pupae. It's very time consuming, but we also collect adult mosquitoes. And we like to talk to humans in the field because we're interested in what they're doing to protect themselves from mosquito-borne diseases. So for example, do they have windows and doors that are screened? Do they wear repellent at the times of day when the mosquito's biting? Do they empty the standing water in which the mosquitoes lay their eggs? That type of thing.
There are numerous different ways that climate is linked with human health. I'll give the example of vector-borne diseases, which are what Mary and I work on. And by vector-borne disease, I mean any disease that's causative agent can be transmitted by an organism like a mosquito. So climate in that system can impact the speed at which the mosquito completes the different stages of its life cycle. So if it's warmer, it can go through more generations and you can get more mosquitoes. It also affects how long the adult mosquitoes live. It affects how quickly viruses can replicate, how quickly they can incubate within the mosquito, the kind of efficiency with which it can transmit a virus. So lots of ways. Water through rainfall also provides habitats for mosquitoes. So numerous ways. And weather can also affect human behavior. It can make, for example, in warm conditions, people might be outdoors more, or if it's rainy, they might be indoors more. So their exposure to disease vectors changes with the weather as well. So that's, we definitely have a lot of ways that the climate is linked with human health. I think things that we can't say definitively are that there's not a direct causative link between climate and human health outcomes like diseases, because there are so many other factors that also affect disease systems. So diseases are very complex, and in particular human behavior, socioeconomic factors really play a strong role in kind of regulating or modulating disease risk. One of the questions we often receive is, will climate change have adverse effects on human health? And I think for many of the problems that Mary and I study, the answer is that climate change has the potential to exacerbate human health issues or to create more suitable conditions for disease transmission. But again, there are all of these other factors that we also have to consider in the future, like how will human behavior change? How will socioeconomic conditions change? What types of changes in medical technology will occur? For example, will a vaccine for a given vector-borne disease be developed? So there are also other factors that could change the future outcomes of human health in addition to climate.
But I was just going to add something to that too. So I think one of your questions was 100 years ago, what would be some of the differences? Well, I think that since the end of World War II, we've seen the growth of megacities, and one of the mosquitoes we study is an urban mosquito, and so that's helped to increase the abundance of this mosquito, that type of environment. But we've also seen more global trade, more global travel. So diseases are able to move around the planet a lot more rapidly than they were in the past.
Okay. Yeah, typically we see that risk for getting a vector-borne disease is at the intersection of human exposure and human vulnerability. So typically many of the hotspots that we see for vector-borne diseases today are in low-income countries, in where people's vulnerability is high, and in tropical and subtropical areas where their exposure to disease vectors is also high. In terms of where future hotspots might be, I think that's one of the questions that we're very interested in getting at. And while we might be able to kind of get at some of the future exposure issues, how exposure might change, we're having more difficulty answering how human vulnerability might change in the future.
And I think even in some of the countries that we consider middle income countries, we see pockets within those countries of poverty. And those are the areas where we have the most difficulty with vector-borne diseases because people have fewer resources to protect themselves. They don't necessarily have air conditioning. And we see this in the southern United States as well, that some of our poorest counties along the Texas-Mexico border, for example, are areas where we've seen repeated outbreaks of dengue fever, for example. So I think that medical anthropology traditionally focuses on human health, but from a biological or linguistic or cultural or social perspective. And what we've done here is brought the climate and the weather component into the study of medical anthropology. So I think we're augmenting that field of study by the type of work we do.
And I can say from the perspective of a meteorologist that it's really been eye-opening to have an interdisciplinary collaboration like we do. In particular, I think as meteorologists, we tend to see problems from our perspective. And in terms of human health issues, you rapidly realize, particularly through field work, that there are really a lot of different drivers that can determine a given human health outcome, of which weather and climate are only one.
So I think we have a unique program here, bringing in the social and the physical sciences. So when we look at the history of vector-borne diseases in the Americas, for example, we know that the Panama Canal was a big issue. Attempts to build it were really thwarted by yellow fever. And so there was a concerted effort on the part of the Pan American Health Organization and many countries in the Americas to try to eradicate Aedes aegypti, the mosquito vector, for yellow fever. And this was a really difficult task to undertake. They had to have people going door to door to actually make sure that containers were emptied of standing water so the mosquito had no place to lay her eggs, at the same time that they were fogging houses inside and outside to try to kill any of the adult mosquitoes. And they were pretty successful. We were able to see a demise of this mosquito through much of the Americas, the Western Hemisphere, but there were a few pockets that were holdouts, and the southern United States was one of those. And once the funding for that diminished, we were no longer able to continue with this eradication program, and so we saw the mosquito making incursions year after year into new countries.
I think it's important to note, as Mary noted, that we've had many different vector-borne diseases in the Americas for a long time. We had yellow fever in Spanish Florida in the 1640s. There's a dengue outbreak in Philadelphia in the 1780s. And so throughout much of the Americas, climate has been suitable for vector-borne diseases, and what we've seen in terms of, for example, a contraction of vector-borne disease transmission in the United States has not been attributed to kind of unsuitable climate. It's more improved socioeconomic conditions and people becoming less exposed to mosquito vectors over the years. So this underscores how important it is when we look at the potential for climate change to affect vector-borne diseases, that we also look at human behavioral and socioeconomic factors.
And we were able to eradicate malaria from the United States by draining swamps and also improving infrastructure. And we've been quite successful at maintaining a malaria-free country.
A vector-borne disease is any disease whose causative agent is transmitted by an organism. Usually we're talking about insects such as mosquitoes or arachnids such as ticks as vectors.
So a vector-borne disease is a disease that is transmitted by a specific insect or arachnid, and we call those vectors. So an example would be a mosquito or a flea or a tick. And these are the agents of dispersal of these diseases.
Lyme disease is the most common vector-borne disease in the United States. We typically see about 30,000 reported cases per year. It's probably underreported by a factor of 10, so we probably have closer to about 300,000 cases a year. Lyme disease is transmitted by the black-legged tick, also known as the deer tick in the eastern United States. And another large disease, vector-borne disease in the United States that's a mosquito-borne disease is West Nile virus, and that occurs throughout the United States. We see fewer cases than we do for Lyme disease, but still quite a few.
And that's an interesting disease because we've seen, we saw West Nile virus enter the United States in 1999 for the first time, and since then we've seen waves of spreads across the United States. So it's gone from east to west, and we still see that it's endemic or found locally in most states in the United States, in the contiguous United States.
And locally, Colorado is a particularly important state for West Nile virus, as we see cases here consistently on a year-to-year basis.
Yeah, we had our first outbreak of West Nile virus here in Colorado along the Front Range in 2003. In areas where people are poorer or have fewer resources, they're less likely to have screens that are intact on their windows and doors. So that's a barrier to mosquitoes coming into the houses. They're less likely to have access to air conditioning, which is also a barrier to mosquitoes. They don't like it cold. They're less likely to have access or the money to buy repellents that are needed to keep the mosquitoes at bay. So socioeconomics definitely plays a role in mosquito-borne disease transmission.
And I think that we see it at the household scale, as Mary described, and also at the community and even larger scale, so kind of governance issues. And so, for example, in a community where where piped water might be intermittent, we see that people are more likely to store water in their yards, and that can create habitats for mosquitoes that transmit viruses. Trash collection, something as simple as that, whether or not that's regularly done in certain, whether or not we have regular trash collection in communities can also play a role in how many breeding habitats we have for urban mosquitoes. So both community level and household level socioeconomic factors can play a big role in modulating disease transmission.
And along those lines, with vector control or trying to keep the mosquitoes at bay, those vector control agencies are often funded by taxes. And if you're in an area where the socioeconomic conditions are somewhat lower, you may have fewer resources to control mosquitoes as well.
Zika virus emerged in the Americas last year, and one of the reasons it's been featured in the media so much is because it's been linked with birth defects and other neurological disorders. So it's had kind of secondary impacts, whereas the infection itself is not that severe. It might be like kind of having a bad cold, maybe. That said, Zika is transmitted by the same mosquito, Aedes aegypti mainly, the same mosquito that transmits dengue and other viruses such as yellow fever, chikungunya, which is a newer virus that's emerged in the Americas. And so we know that the dynamics of Zika are similar to those of dengue, which we've had for a long time. And we haven't seen, while we've seen dengue occur regularly in much of the tropical and subtropical Americas, as we get up into the United States, even though we have the mosquito Aedes aegypti that transmits dengue, we haven't seen large-scale outbreaks. We've seen kind of mini outbreaks in different counties that get tamped down pretty quickly, and we think that the reason for that is that people are less exposed in the United States in general. They tend to live and work in air-conditioned environments, and also we have pretty comparatively good vector control in some of the mosquito control in some of the areas where we have Aedes aegypti.
So we know that Zika first made inroads into Brazil approximately May of 2015, and since that time we've seen it spread to most countries in the Western Hemisphere. We have not seen any locally acquired cases through mosquitoes in the United States. There has been some sexual transmission that's suspected, but no mosquito-borne transmission in the U.S., in the contiguous U.S., I should say. Puerto Rico is reeling from Zika at the moment, and whether it will make inroads into the U.S. is a big question, $64,000 question.
The consensus from assessments of the potential future impacts of climate change on human health is that, in general, climate change has the potential to lead to expanded ranges for disease vectors such as mosquitoes, and perhaps overall more favorable conditions for disease transmission. The consensus that has emerged from the few assessments there have been of the potential for climate change impacts on human health is that, in general, there may be more suitable environmental conditions for disease transmission. For example, warmer temperatures that could lead to expanded ranges for disease vectors such as mosquitoes, but that other factors such as human behavior, socioeconomic conditions, unknown changes in medical technology such as the development of vaccines, that those may also have a big impact on future health outcomes, and we really don't know how those factors are going to play out in the future.
Well, I think that it's not just with vector-borne diseases. These reports also focus on, for example, the impact of increased heat in urban areas on human health. And we know that when we see increasing heat waves, that it will have a detrimental effect on the population.
The linkage between extreme heat and human health is a little bit more direct.
Mm-hmm. We have a very unique program here at NCAR in collaboration with the Centers for Disease Control and Prevention, whereby we bring in postdoctoral fellows for 2 years. And these fellows spend a year here at NCAR learning about our weather, climate, and health program and working on developing climate models. And then they spend a year at CDC, also working on modeling, but also learning more about epidemiology. So we feel that we have a unique cohort of fellows who've graduated from this program, and we'll have 2 more coming in shortly. But they're able to bridge that gap between climate and health from both sides of the coin. We have some people who have come in as ecologists, others as social scientists, others as disease ecologists, medical geographers. Some of them have backgrounds in atmospheric science, but not necessarily. I think it's a new emerging field, and I think that we'll see more and more people interested in connecting weather, climate, and human health.
Our group typically addresses maybe what could be broadly characterized as 3 types of questions. Some of the questions are trying to gain a basic understanding of how climate-sensitive disease systems work. Other questions we address are really linked at developing decision support tools that can help aid stakeholders such as mosquito control personnel or public health decision makers in making their decisions. And the third type of questions we address are linked with how climate change may impact human health outcomes in the future. And all 3 of those have many unanswered questions, so I think that the field will continue to be a healthy one as we move into the future.
No pun intended.
Yeah, that's true. Yeah. For many of the vector-borne disease issues that we research, in terms of climate change, what we typically see in projections are that we may see increased geographic ranges for disease vectors such as mosquitoes, and also earlier and later transmission of diseases, so earlier into the spring or later into fall for transmission of diseases like West Nile virus, for example, or Lyme disease. So we could see both spatial and temporal changes in disease characteristics with climate change.
And I think one of the other things I was going to mention is an NSF-funded project for which Andy was the PI. We found the mosquito Aedes aegypti at 2,100 meters, so we were able to document it for the first time at that elevation in Mexico. And in this particular town where we found the mosquito, we had seen a 0.2 degrees Celsius rise in temperature each decade for the past 4 decades. So whether that's causal or not, it's hard to say, but it's interesting.
We recently had a project in Mexico in which we investigated the mosquito Aedes aegypti, which transmits a number of viruses such as Zika, dengue, chikungunya, and yellow fever. We looked at abundance of the mosquito in 12 different cities on an elevational transect that went from a warm, humid, wet city on the coast of Mexico up to the Altiplano of Mexico at about 2,100 meters above sea level, where it's much cooler and drier, and it's right at the margins of where this mosquito can survive. And we found the mosquito even up at 2,100 meters. It was the highest that this mosquito had ever been found by 300 meters. And we're uncertain whether that has to do with the fact that we've seen a pretty strong warming signal there over the last 50 years or so. So it may be that this mosquito is climbing up in elevation. And one of the interesting things we found is that there are no socioeconomic or other behavioral barriers to this mosquito being able to establish in those higher elevation areas. So in this case, it literally would be a matter of time until the climate is suitable enough for this mosquito to establish. And that's important because up on the Altiplano, that's near Mexico City, where we have about 20 million people who currently aren't exposed to the viruses that this mosquito transmits. I was
He was
trying to
avoid.
simplify.
Yeah.
But it was close to Mexico
Yeah.
City, so. Quito's at a much higher elevation, though. Quito's at about 9,200 feet, so.
I have some pictures of you in Mexico.
Oh, you do?
Yeah, I gave you a camera once or something.
Oh, I don't even remember that.
That's pretty
Oh my
funny,
God.
actually.
Yeah.
Yeah.
Don't
It
put those in.
It wasn't your priority.
Okay. I must have forgotten about it all the time, right? Snapping inadvertent pictures. Yeah, great.
Yeah, I think we're good. I think we have enough. I mean, obviously it's going to be short, so I've got
Yeah.
more than enough to
Okay.
go by. And I'm happy to share the footage with you if you find another place you want to use it.
Okay.
You know, that's
Yeah.
perfectly fine. So I'll put it on a disc or something
Okay, cool.
for you and send it over.
Cool.
So anything else you guys want to say?
I don't think so.
I think we're good.
Okay.